High blood pressure or hypertension, diabetes, low birth weight, preterm birth, urinary tract infection, and heredity are the commonly known causes of kidney or renal diseases. What is not commonly known, however, is that woodworkers are also highly exposed to such diseases. We try to find out whether these manual workers are aware of this situation. A report by Ashanti regional correspondent Nicholas Oseibusu.
The woodworks value chain begins from the forest, where logging is done. The chain then continues through transportation to either the large-scale timber companies or mills, where the processing takes place. It is at this stage that the timber logs are cut into pieces and various shapes and designed into products such as veneer, plywood, T&G, furniture, and wooden crates for packaging items such as vegetables. All these processes involve people, mostly energetic men in their prime ages. The inherent danger to their health is scary. A nephrologist at the Komfo-Anokye Teaching Hospital, Dr. Patricia Kufuor, explains the health challenges that woodworkers face.
People who have been exposed to sawdust or wood dust or wood shavings have a very high diagnosis rate of chronic kidney disease. There are some specific substances in the wood dust that are carcinogenic. It means it's cancer causing. So it normally can cause cancer to a lot of organs, including the kidneys.
A nephrologist is a specialist physician in charge of kidney health.
The dust that is coming to the person is coming in high quantities. It has its own substances, a carcinogen or whatever it is. Sometimes it has fungi, sometimes it has yeast, sometimes it has even bacteria, giving them infections. The normal form of hypersensitivity reaction we know for these kind of people is maybe they will sneeze a lot, they will be coughing, they will act like they are choking, and then sometimes they get a rash. But what we don't know is that some of these hypersensitivity reactions are also occurring in other organs, including the kidneys. And if it is not detected early, it is very slow in progress. It's not like it will make you sick or it will make you nothing. So by the time we get hold of you, your kidneys are small, and that is the end of the story.
The workshop at Ahinsai is owned by a group of friends who make dressing mirror and Ludo. 41-year-old John Amoa and Kojusechi, 48, have been in the business for 30 years. They spend long hours each day milling the wood into desirable shapes and sizes for their end product, during which they generate volumes of sawdust or wood dust. They were not aware of the health hazards in their jobs. GBC News also went to the Wood Village enclave at Sokoban in the Kumasi metropolis, where people are engaged in all manner of woodworks. While a few of them had improvised nose masks and goggles as safety gadgets, the vast majority had no protective gear and inhaled the sawdust. One of the master craftsmen, Mr. King George Eklu, said he was aware of the health hazards, and that is why he wore improvised nose mask. Several pieces of advice given to his colleagues to wear nose masks have fallen on deaf ears.
If you advise someone to do something, if the person don't like it or person don't do it doesn't mean so that you have to force it.
We found out from the nephrologist, Dr. Patricia Kufuor, whether or not kidney problems come suddenly.
You may not have had any problem with the kidneys, but for this short time, the kidney gets compromised. We categorize them into acute and chronic because when we say acute, then we are so aggressive looking for the cause. Because if you treat the cause, the person should be okay. So assuming you went to take some herbs or some drugs and you have gotten this kidney problem, we have to take off that drug. If it's an infection, we treat the infection aggressively. If it's malaria, if it's diarrhea and vomiting, we fix the volume. And we hope that your kidneys should get back to where it was. But when we say chronic, it's something that has been going on for some time. There is nothing you can do about it. By the time you are seeing it, it's far advanced. There's no going back.
She suggested how woodworkers and their employees could reduce the risks of contracting renal problem.
The people who are employing them, they should also build ventilators that can suck out the gas, like the food extractors do, the stove extractors. they can suck out those dust so that the exposure will be minimal. And then if it's a big company, they should rotate them such that it's not one person or a group of people who are always exposed. There should be some breaks in between.